Hello, my name is Charity Anderson, and I'm a PhD student at Bowling Green State University's English Department. My presentation today, Accessibility Conscious Language Within Literature, How to Become Aware of Invisible Feats, will provide a brief introduction to the ongoing conversation of shifting language use in literature and how it relates with the disabled community. This presentation will serve several purposes. We will look into the strides being made in the guidelines for terms of able-bodied language and writing. We will then look at examples of common terms that could be reworked into more accessibility-conscious choices. I will then encourage you to complete a set of writing tasks that will challenge your way of using accessibility-conscious language. So, how do you refer to someone with disabilities in your own writing? This will be the ultimate reflection question that this presentation aims to help answer. Accessibility practices are often associated with legal and ethical compliance within business practices. The application of accessibility consciousness, however, is an ever-growing social responsibility within many circles of life. Cultural elements, such as literature, can be contributing participants of this expanding consciousness deflation or inflation without even seeing the memorable moments taking place. This presentation aims at making those invisible strides more recognizable within the practice of reading and writing literature. Although people with disabilities sometimes refers to a single population, this is actually a diverse group of people with a wide range of needs. Two people with the same type of disability can be affected in very different ways. Some disabilities may be hidden and not easy to see. According to the World Health Organization, disability has three dimensions. 1. Impairment in a person's body structure or function, or mental functioning. Examples of impairments include loss of limb, loss of vision, loss of memory. 2. Activity limitation, such as difficulty seeing, hearing, walking, or problem solving. 3. Participation restrictions in normal daily activities, such as working, engaging in social and recreational activities, and obtaining health care and preventative services. The CDC describes a disability as any condition of the body or mind, also known as an impairment, that makes it more difficult for the person with the condition to do certain activities, also known as activity limitation, and interact with the world around them, also known as participation restrictions. There are many types of disabilities, such as those that affect a person's vision, movement, thinking, remembering, learning, communication, hearing, mental health, and social relationships. Members of the public often only recognize visible disabilities through signifiers like the use of a wheelchair, but millions of people have what we refer to as hidden or invisible disabilities, like major depression or generalized anxiety. When it comes to writing about any person with any type of disability, there are some basic guidelines. Refer to a disability only when it's relevant to the story, and, when possible, confirm the diagnosis with a reputable source, such as a medical professional or other licensed professional. When possible, ask sources how they would like to be described. If the person or persons are not available or unable to communicate, ask a trusted family member, advocate, medical professional, or relevant organization that represents people with disabilities. Avoid made-up words like diversability and handicapable unless using them in direct quotes in reference to a movement or an organization. Be sensitive when using words like disorder, impairment, and special to describe the nature of a disability. The word condition is often a good substitute that avoids judgment. But note that there is no universal agreement on the use of these terms, not even close. Disorder is a complicated word because it can be used effectively when referring to medical references. And the same can be true for special when in reference to things like special education. So it is appropriate to use them on certain circumstances, but proceed with caution. Likewise, there is not really a good way to describe the nature of a condition. High functioning and low functioning are considered offensive. Severe implies a judgment. Significant might be better. Again, proceed with caution. As language, perceptions, and social context change rapidly, it is becoming increasingly complex for writers to know how to refer to people with disabilities. For example, the term disability itself is not even universally accepted. There are reference guides available, such as the National Center on Disability and Journalism at Arizona State University's Walter Cronkite School of Journalism and Mass Communication, which was last updated in the summer of 2021, where writers can review the most up-to-date advice and practices. In order to inclusively write about people with disabilities from the point of view of someone without a disability, effort and research is necessary. For example, able-bodied is also not a universally acceptable word choice. This term is used to describe someone who does not identify as having a disability. Other members of the disability community oppose its use because it implies that all people with disabilities lack able bodies or the ability to use their bodies well. They may prefer non-disabled or enabled as being a more accurate term. The use of the words typical and normal are also objected to by the disability community. There are many other terms to be aware of as you develop accessibility-conscious language in your writing, but for the sake of time, I've selected 3 more sets of terms that are commonly used. The first is abnormal or abnormality, which are words used to describe a condition that deviates from what is considered normal. It can be appropriate when used in a medical context, such as abnormal curvature of the spine, or an abnormal test result. However, when used to describe an individual, abnormal is widely viewed as derogatory. The phrase abnormal behavior reflects social cultural standards and is open to different interpretations. Referring to someone who does not have a disability as a normal person implies that people with disabilities are deviant or strange. The next set of terms is addict or addiction. Addiction is a treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. According to the American Academy of Pain Medicine, addiction often implies dependence on substances other than alcohol, although alcoholism is essentially alcohol addiction. The American Psychiatric Association discourages using derogatory language such as the term junkie in reference to someone who misuses drugs. According to the U.S. Department of Health and Human Services, Center for Substance Abuse Treatment, the word addiction is acceptable for uncontrollable compulsive use of substances, as well as acts such as gambling, sex, working, etc., in the face of negative health and social consequences. The center also states that addiction differs from dependence. Do not use the terms addiction and dependence interchangeably. Addiction usually refers to a disease or disorder. Dependence may, on the other hand, describe babies born to mothers who use drugs or cancer patients who take prescribed painkillers. The center also recommends using the word misuse in place of abuse when describing harmful drug usage. It's best to avoid using clean and dirty with regard to drug test results, according to the Center for Substance Abuse and Treatment. The terms are considered derogatory because they equate symptoms of illness to filth. When referring to a drug test, state that the person tested positive for whatever they tested positive for. Addiction is an acceptable term. Although some prefer substance abuse disorder, it is preferable to refer to someone who harmfully uses drugs as someone with a drug addiction, rather than addict. Use recovering or in recovering from in reference to someone trying to overcome an addiction. That is, someone recovering from a methamphetamine addiction. Avoid words like abuse or problem in favor of the word use, with an appropriate modifier such as risky, unhealthy, excessive, or heavy. Misuse is also acceptable. Do not assume all people who engage in misuse have an addiction. Avoid words like alcoholic, addict, user, and abuser, unless individuals prefer these specific terms to describe themselves, or if they occur in quotations or names of organizations such as Alcoholics Anonymous. The third set of terms to consider are crazy, loony, mad, psycho, nuts, deranged. These words were once commonly used to describe people with mental illness but are now considered offensive. They are still used in a variety of contexts but should be avoided. Do not use these words, particularly if you are writing on mental illness, unless they are an essential part of the story. Now that we've covered just a few of the very many terms that should be rethought or rephrased in writing in order to develop accessibility conscious language, and we have introduced some basic guidelines to become aware of, I have a writing challenge for you to complete in your own writing. 1. Ask a person with a specific disability or a disability organization about their preferred terminology. 2. Use medical diagnoses and describe an individual's abilities and challenges, rather than using less specific labels. 3. Avoid making the disability the person's identity. For example, someone with an amputation is generally more acceptable compared to amputee. 4. Avoid using disability-related words lightly or in unrelated situations. And 5. Be aware and sensitive to how words, however common they may also be derogatory and ultimately deflate the accessibility conscious language growth in literature. All right, this concludes my presentation, and I thank you very much for your time.